Good afternoon. Let me present my PhD topic, which is New Insight in Cachexia Prevention in Gastrointestinal Cancer. My name is Bettina Budai. I am a dietitian and a first-year PhD student. My vision is that nutrition is a cornerstone in the multimodal care of all cancer patients. And my mission is to carry out scientific activity to bring innovation in the nutrition therapy of cancer. To achieve this, I have two specific goals. Firstly, we investigated the risk factors for malnutrition in patients with gastrointestinal cancer. And in my second project, we plan to investigate the effect of amino acid supplementation in gastrointestinal cancer patients. My first project started in September last year. The prevalence of malnutrition in gastrointestinal cancer is up to 30 to 90%, depending on the tumor site and tumor stage. The presence of malnutrition is a common feature in cancer. The development of it is the presence of the tumor, is the consequences of the presence of the tumor, but also the consequences of the medical or surgical anti-cancer treatment. It has been estimated that up to 10 to 20% of cancer patients die due to the malnutrition rather than due to the tumor itself. Cancer-related malnutrition is still unrecognized, underestimated, and undertreated in clinical practice. The presence of malnutrition can significantly worsen the prognosis, decrease the overall survival, and increase the financial burden on the healthcare system. It is multifactorial. That means that there are various risk factors that can contribute to its development. Moreover, the exact causes and mechanisms hasn't been completely elucidated. To take into account this information, our aim was to investigate the risk factors for malnutrition in gastrointestinal cancer. We wanted to get the answer of the clinical question, what are those risk factors in gastrointestinal cancer that can increase the development of malnutrition, and we hypothesized that there are some specific clinical and biological factors. We did the systematic search in 3 databases with the final search key, and at the end of the selection, we identified 392 eligible articles for the data analysis. Currently, we are at the stage that we submitted all of the data to the statistician for the analysis, and we have received approximately 20% of the figures. From these more than 300 articles, we could identify the really huge amount of risk factors that may have an impact on the malnutrition. For the better understanding, we categorized it into 5 major categories. The first one is the population characteristics like age or sex. The second one is the laboratory parameters. The third one, comorbidities. We could analyze not only the presence of comorbidities in general, but also the presence of diabetes mellitus or, for example, hyperlipidemia. The next category is the tumor characteristics, and the last one is the therapy, the presence of the neoadjuvant chemoradiotherapy or the presence of neoadjuvant chemotherapy alone. Our main outcome was the impaired nutritional status. We separately analyzed the presence of cachexia and the presence of malnutrition. In the literature, there are various definitions of the malnutrition, so we analyzed it according to the used assessment tools. The first one is the risk screening tools. They are measuring the malnutrition risk and mostly based on weight loss or BMI or decreased appetite. The next one is the diagnosis of malnutrition. For it, in 2018, the CLIM criteria was established. And the last one are the prognostic scores. Prognostic scores are validated tools that measuring the prognostic effect of malnutrition on the cancer-related mortality or morbidity. They are mostly based on serum levels, like serum albumin level, total cholesterol level, or total lymphocyte count. And let me present some of our results. In this first figure, you can see the association between alcohol consumption and malnutrition. We could include in the analysis 11 articles with approximately 3,000 patients. The results statistically not significant. We did a subgroup analysis, but in case of esophageal cancer patients, We couldn't find any statistically significant association between alcohol consumption and malnutrition. In the next figure, you can see the association between alcohol consumption and malnutrition in hepatobiliary cancer patients. We could include in the analysis 5 articles with approximately 800 patients. The result statistically not significant, and similar result is shown in the subgroup analysis for only hepatocellular carcinoma patients. In the next figure, we even investigated the association between neoadjuvant chemotherapy and malnutrition. We could include in the analysis 11 articles and approximately 3,000 patients. The result statistically significant and shows that in case of neoadjuvant therapy, there is 80% higher odds for developing malnutrition in those patients who are not receiving neoadjuvant chemotherapy. We did a subgroup analysis for only the upper GI cancer patients as well, but we couldn't find statistically significant result. One of the explanations can be that in upper GI cancer, the symptoms like vomiting or dysphagia decreasing the food intake, so the development of malnutrition is much more easy. In the last figure, we can see the association between neoadjuvant radio or chemotherapy and malnutrition. We included more than 15 articles and more than 6,000 patients. The result statistically not significant. We did a subgroup analysis for resectable and non-resectable cases as well, although in the not resectable cases, we only could include 1 article. I'm working on the manuscript as well. I am ready with the methods part, and I'm working on I started the results part. Of course, we know that firstly we should be ready, but we selected a journal now called Clinical Nutrition. In my second project, I plan to investigate the effect of amino acid supplementation in gastrointestinal cancer patients. At the diagnosis of cancer, all patients have to be screened for malnutrition and offer nutritional support as needed. The presence of malnutrition in patients who should undergo oncological treatment can increase the toxicity, decrease the performance status, quality of life, and treatment response. There are contradictory data regarding the proper use of amino acid supplementation. Some data suggest to use branched-chain amino acids to improve the fat-free mass, and some suggest to use glutamine to prevent mucositis. To take into account this information, our aim is to evaluate the efficacy of amino acid supplementation in gastrointestinal cancer. The clinical question is, what is the efficacy of amino acid supplementation? We are going to investigate gastrointestinal cancer patients, and the outcome would be nutritional status, quality of life, and survival. We hypothesized that amino acid supplementation can improve the nutritional status and quality of life, but does not improve prognosis in patients with gastrointestinal cancer. We did the preliminary research and we identified 3 key articles. Both are investigating gastrointestinal cancer and the efficacy of amino acid supplementation, like the branched-chain amino acids or the glutamine. As a summary, I would like to say the submission date for the first project is end of this year, for the next second project in the middle of the next year. I would like to thank you for your attention with this quote. Impossible only means that you haven't found a solution yet. Thank you.
Thank you for the presentation. I would like to know how did you manage to adjust the confounders in your analysis for the risk factors, because it can be the case that one is affecting the other. So how did you manage to minimize these the confounding factors?
Thank you for your question. I think it is quite hard to manage these confounders because, of course, in our data, we can see, for example, for the first 2 analyses, that there isn't any significant association between alcohol consumption and malnutrition, but it was measured by the prognostic score that contains the total cholesterol level. And in case of a huge amount of alcohol consumption, the total cholesterol level can be increased. So maybe that suggests to us that it's not the best tool to reflect the nutritional status. So in our analysis and in our article, in the discussion part, we really should have a focus on this and and concentrate about this part.
Thank you. And I have another question regarding the second topic, which is, are you going to investigate all the organs or just the gastrointestinal tract, or which ones are you going to include in the GI patients?
Yeah, so the first idea was that all of the organ in the gastrointestinal system, but as you see in my first project, we got a really huge amount of data. So firstly, we should create the search key and see what is the expected number of hits, and maybe we are going to reduce it. In our preliminary research, I found mostly those articles that investigate hepatocellular carcinoma. This is in the main focus, as I see.
Regarding your second project, do you think it is important to make a difference between potentially curable GI cancers and amino acid supplementations versus incurable GI cancer? Because I think the addition of amino acids into GI cancers depends on what we want to achieve. Is the patient on the palliative pathway, and do we want to achieve? So do you think there's a point around it? Because that can limit the number of eligible studies in your study.
Yes, thank you very much. You're absolutely right in this case, because of course, in case of palliative cancer patients, our aim is different. So these amino acid supplementation are good to, for example, improve the fat-free mass. This is the main aim. But in case of palliative cancers, maybe we can, through this increasing the fat-free mass, we can improve the quality of life. So both has meaning, but at the end, the aim is a little bit different.
My intention is to make your second project a little smaller.
I know.
Just a little smaller
I know.
than the first one.
Thank you.